All right, we're going to go to amendment number 6, which is again by Representative Randolph.
Thank you, Mr. Chairman. This amendment simply and unfortunately, doesn't pull back in all the autism provisions that were in this bill, but simply strikes lines 81 through 82 and reinstates coverage of certain autism provisions. I'll make note that this provision in law, ironically, was the very last piece of legislation that Speaker Rubio spoke on from the Speaker's podium in 2008. And in fact, his very last words as Speaker of the House were, "I wish this bill went further." And so I ask that 3 years later, we not take away the legacy of our now Senator Marco Rubio, and that we leave this provision in law.
Having presented his amendment, do we have any questions of the amendment sponsor? Seeing none, do you have any comments from the bill sponsor on the amendment?
Again, members, I've stated what the philosophy and the intent of this bill is. We know that autism is a condition that needs treatment. We are focusing on how health insurance is sold and the cost of it and the cost drivers. And again, my statement is that this autism is certainly a very, very dreadful condition for everyone to have, but it's better to treat this issue of how to buy health insurance through a informed marketplace instead of a government mandate.
All right. So and do we have some public
amendments unfriendly?
Public testimony, Senator Geller.
Thank you, Mr. Chair, members of the committee. I'd like to begin by thanking Representative Wood for working on the issue of reducing health costs. Certainly it's a well-intentioned bill. This is the wrong particular issue, and I'd like to thank Representative Randolph. Since the bill is repealing the Stephen A. Geller Autism Treatment Act, and I'm Stephen A. Geller, I thought I should comment on this. This bill was a priority of the Florida Senate. It was not just me. It was Dan Webster, Ken Pruitt, Lisa Carlton. This bill was an absolute priority. It's not anything that slipped through. It was one of the 3 or 4 most highly discussed issues of that session. And not only did Webster, Pruitt, and Carlton, as Representative Randolph said, the opposition in the House, you will remember, some of you, there's not as much institutional memory, but the Speaker's objection to this was the bill didn't go far enough, that it only treated autism and it did not deal with the other developmental disabilities. That's what his objection was. But he closed by saying that this issue is critical to the children of the state of Florida, which is why Speaker Rubio urged support.
Susan Goldstein from Weston. I'm the parent of a daughter with autism. Insurance should be a mutually beneficial concept. My policy premium pays for your child's diabetes. Your policy premium should pay for my child's autism. Well, it didn't work that way, and it doesn't work that way for a lot of these things. But the problem is, if these children do not get this intervention, it will cost the state more money. We have 20,000 people on a waiting list for services.
Thank you, Victoria Zepp. I handed in a card. I'm a parent advocate. But there's a 2006 Harvard study that found a child with autism, if not properly treated, the societal cost for that child over their lifetime is $3.2 million. Yet, we know that with the early interventions, that 75% of the children that do receive the early interventions that are on the autism spectrum are able to then go out, become effective individuals that are eligible for jobs and being part of our ecosystem here in the state of Florida.
My name is Ron Watson. I'm a registered lobbyist, but I'm here today to speak to you as a parent. I'll be very brief, and I'm sorry I didn't get a chance to speak with you prior to this, sir. But the highest accomplishment that I've ever had in my 21-year career was helping pass this law back in 2008. It's made a huge difference for my child.
Hi, I'm Elisa Snow. I'm here today representing the Alliance for Pediatric Therapies. We consist of pediatric therapy providers, OT, PT, and speech. We've already heard testimony about the benefits of children who get therapies at a young age. If they don't get those therapies, those children will not progress, they will not develop, so you're going to wind up with them in the Early Steps program on the waiting list for the Agency for Persons with Disabilities, the very programs that you all struggle to fund every year. So please vote in favor. I implore you, please vote in favor of this amendment.
Any further public testimony? If not, would you like to close on debate on the amendment? The debate. Yes, Representative Ford, please.
Thank you. The only way I can vote for this bill is if this amendment passes. I was in my first term at the time we passed the autism bill, and I'd like to remind the members on this committee that it passed with 83 co-sponsors. This was not something that squeaked through. I don't remember the vote count, but I do remember 83 co-sponsors. I'm urging you today to vote for this amendment.
Thank you. And Representative Porth.
Thank you, Mr. Chair. Members, helping our most vulnerable is why I ran for office, and passing the Steve Geller Window of Opportunity Act was my proudest moment here in the House. I was Senator Geller's House sponsor of the Window of Opportunity Act. Those words, window of opportunity, I came up with some parent activists from home in Broward, and came up with that title on a little napkin, and they told me it was a window of opportunity because if you catch those kids between the ages of, Senator Geller said 2 and 8, but even between 3 and 5, if you get them at that age and you get them these applied behavioral therapies, they can be mainstreamed into classes. They can be socially appropriate. They can be verbal. They can have tremendous and amazing lives. And I met an amazing family. The Barta family, who I was with this weekend.
You've got to shorten your debate as best you can so we can have public testimony of the bill.
Let me just say that I met the Barta family this weekend at the Dan Marino Walk, and their son Dylan has succeeded because of these therapies, and there are thousands of families across Florida like the Barta family, and please pass this amendment for them.
Thank you. Any further debate? If not, Representative Randolph, you're recognized to close on your amendment.
Thank you, Mr. Chairman. I think so many of these advocates have spoken very well on this. And we're going to go back to the concept of insurance and whether these children would have been able to get these services had this bill not passed. And it is absurd to think that unless a parent happen to buy or come across a separate rider somewhere, not that we're mandating even separate riders because we're getting rid of those mandates and other provisions of the law, that these children would ever become the productive members of society that they can become. So I ask for your support of this amendment today, and I know that if Senator Rubio were here as well, that he would ask for your support, given that it was the last thing he did as Speaker of the House.
Okay, having closed on his amendment, let's go roll call vote.
Representatives Ahern? No. Boyd?
Yes.
Ford?
Yes.
Gonzalez?
No.
Hudson?
No.
Jones?
Yes.
Nunes? Oliva? Forth?
Yes.
Randolph?
Yes.
Reed?
Yes.
Benuart?
Yes.
Rooney? Yes. Schwartz? Yes. Chair Wood?
No.
The amendment passes.
Thank you. With your vote, we show the amendment passing.